Lymphoma in my eyes. Are there anybody who is not afraid of cancer? So quiet. Nobody want to say anything? Okay. This tells me that all of you are scared of cancer. It is true. Cancer is an awful word. It can make us turning pale by just mentioning it. As if we all know that if someone was diagnosed with some kind of cancer, then he or she was just sentenced to die. There is no any other alternative path for him or her to take. To such a great extent, yes, it is. Here, I want to inform each one of you, however, that lymphoma cancer is not as awful as you think it is. After my speech, I want all of you to know that you might feel dreadful after being labeled as a lymphoma cancer patient, but you will still have reasons to feel thankful, since you were diagnosed with lymphoma cancer instead of any other kinds of cancers. There are 3 factors about lymphoma cancer that might be able to keep you in a positive attitude toward your life, even though the word is awful as it is due to its name, cancer. Before I heard these 2 words, lymphoma cancer, from a friend, I was like any one of you, believing that cancer means death. I changed my attitude, however, since last time I saw my friend who was diagnosed with lymphoma cancer 15 years ago, still alive and being very healthy at his 85 years of age. It makes me wondering that this friend of mine is so unbelievable that he can fight against the cancer. Except this lymphoma cancer, he is physically and emotionally very healthy. I have no doubt about that. But it is still an unbelievable truth that he can put up with cancer for 15 years. Therefore, this unbelievable truth pressured me to sit down in front of my computer to do some research on lymphoma cancer to find out what it is that makes lymphoma cancer is not as lethal as the word cancer sounds like. Finally, I summarized my research results into 3 factors related to lymphoma cancer that can conjure a ghost of smile on your face, and it's a condition that you're diagnosed with lymphoma cancer. Lymphoma cancer is a kind of cancer that begins in cells of the immune system. So one of the factors that can contribute to the better prognosis of lymphoma cancer is that there are many types of lymphomas, since in the immune system there are many types of lymphocytes. Basically, there are 2 categories of lymphomas, i.e. Hodgkin lymphoma and non-Hodgkin lymphoma. Hodgkin lymphoma is marked by the presence of a type of cell called the Reed-Sternberg cell. Non-Hodgkin lymphoma includes a large, diverse group of cancers of immune system cells. Non-Hodgkin lymphomas can be further divided into cancers that have a slow-growing course and those that have a fast-growing course. These subtypes behave and respond to treatment differently. Among all of these subtypes of lymphoma cancer, there are 5 types of Hodgkin lymphoma whose 5 years of survival rate is 85%, with 80% being cancer-free. The rest of the subtypes belongs to non-Hodgkin lymphoma, whose 5 year survival rate is 63%. With the improvement in treatment of non-Hodgkin lymphoma, however, the survival rate is becoming better and better. Another factor that contributes to better prognosis of lymphoma is the relationship between survival rate and status that the lymphoma belongs to when it was diagnosed. No matter what kind of cancer you are diagnosed with. It has been always the truth that the earlier the diagnosis is, the better the prognosis. For lymphoma cancer, however, it tends to be noticed and diagnosed at stage 1, which will improve the 5-year survival rate tremendously. The reason that lymphoma cancer tends to be noticed and diagnosed at an early age is that the signs and symptoms of lymphoma cancer can prompt doctors' attention of this disease. If the signs or symptoms suggest that a patient may have non-Hodgkin lymphoma, sure, the tests and exams will be done to find out. The signs and symptoms of lymphoma cancer are obvious. It is easy for patients to notice that there is something wrong and complain to doctors, such as enlarged lymph nodes, swollen abdomen, chest pain or pressure, etc. The third factor that contributes to better prognosis of lymphoma is that there are many factors having something to do with the prognosis of lymphoma cancer. The prognostic factor for patients with early-stage Hodgkin lymphoma includes age. Younger than 45 years old, the prognosis is better. Gender. The prognosis of female is better than male. People with lymphocyte predominant Hodgkin lymphoma, nodular sclerosis Hodgkin lymphoma, and lymphocyte-rich classical Hodgkin lymphoma have a better prognosis comparing with other subtypes of Hodgkin lymphoma. The number of lymph nodes size involved, the less the better. All of these factors, if considered all together, will comprehensively increase the survival rate of lymphoma cancer on average. Summing up, the above 3 factors related to lymphoma cancer indicate that lymphoma has a pretty good cure potential. Its survival rate is not as lethal as it sounds like as a cancer. So if any one of you or your significant other or relatives is diagnosed with lymphoma cancer, don't go into panic. Calm down first to sort out the prognostic potential with a good hope, so that they can get ready emotionally to fight with it.